Tonight, health officials are a frustrated lot. Violation of safety rules by political leaders who are holding political gatherings and non-compliance of the rules by the majority of Kenyans is threatening to erode gains made by the country in containing COVID-19 infections. As our very own Dorcas Wangira reports, many Kenyans have thrown caution to the wind and have returned to normalcy.
At the AIC Milimani Church in Pipeline, Nairobi, Sunday service marches to the tune of a different order. Social distancing is observed. The congregants wear masks, but for some, the masks hang at the chin. The politics of the pulpit is back. Politicians taking advantage of where more than 3 are gathered. But when the service is over, a rally takes shape. Like moths drawn to light, hundreds throng to hear from the deputy president. A classic case of when you give an inch, people take a mile. Many are not even wearing masks, and it is a hard task to maintain social distancing. More political and social gatherings were held this weekend in Western Kenya and Nairobi. This, still at the time of a pandemic, and with a curve far from flattening. In our spot check, we observed that many were not observing the containment measures. Enforcement was lax. The night curfews are not being strictly observed. Even on social media, the conversation of a flattening curve and declining COVID-19 cases is a mainstay. We roll the question of why to the court of public opinion.
Kuvaa maski kila wakati na pesa ya COVID mmesema imetumiwa vibaya au sio? Si hivyo, hakuna COVID.
Mimi maski yangu wacha ikaa hapa ifunike ndefu. Chuo kitu nimesikia cha kwanza, idadi ya wagonjwa imerudi chini. Kitu ya pili, kuvaa maski na sio askari asinishike.
Ni yu akarau. Tafadhali, mimi nimeokoka. Ni yu akarau. Huyo ndio naogopa.
Against this backdrop, 263 new positive cases were recorded from 4,424 samples in the last 24 hours, bringing the total number of positive cases to 34,057. Kenya's cumulative tests total 450,146. 98 recoveries were recorded, bringing the total recoveries to 19,688. 2 deaths were recorded, Kenya now having lost 574 people to COVID-19. The test positivity rate stands at 7.5%. That is the share of COVID-19 tests that are positive. It is still higher than the recommended 5% consistently for 14 days by the WHO before a country can significantly relax its containment measures and these restrictions. The curve that shows the trajectory of the infections has a bend that could be mistaken to be a decline in cases, transmission and community spread. However, Kenya is still not testing enough. Without adequate reagents, it is still not possible to test as many people as possible, especially past the 1 million mark.
We articulated this with the DG that primarily the main issue was the reduced testing that was occasioned by challenges in our labs that had calmed down but are now soon to be activated. And that's why you saw the dip.
Dorcas Wangira, Citizen TV, Nairobi.